This hard-working college student ended up in the fight for his life. Today, we learn his surprise diagnosis and meet the mom who ended up saving her son. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Adrian Salazar was 18 years old when he just felt sick. He felt exhausted, and he just was not getting any better. He would soon end up spending months in the hospital trying to survive a stage 4 cancer diagnosis. He did survive, thanks in part to the support and the love of his own mother, who became his caretaker, his cheerleader, and ultimately his stem cell donor. And we are sitting with them today, Adrian and his mom, Adrian Salazar. Good morning to both of you. Good morning. So glad to have you both with us.
Thank you.
And you're going to share your story with us today alongside Dr. Sunil Abhyankar. He is a hematologist and oncologist at the University of Kansas Cancer Center, as well as the director of the Midwest Stem Cell Therapy Center. Dr. Abhyankar, good to see you.
Good morning. Good
nice to be sitting next to one of your patients, as always, right?
Yes.
So it's good to reunite you. Adrian, so you're about ready to wrap up school, your first year, freshman year. You're full-time student, full-time working. You start to feel sick. What symptoms were you feeling?
I honestly just felt really withdrawn, just really exhausted. I'd sleep and I'd still feel tired whenever I woke up, and I was just honestly sleeping majority of my days. I just go to school, come home, sleep.
Well, and you hear a lot of teenagers sleep, right? So you're thinking, but you knew, even though you're working full-time and you're going to school full-time, that there's just something wasn't right. At what point did you realize that you needed to get to urgent care?
So I was having a lot of severe throat pain. I thought it was strep or something. I was like, oh, I just have something that won't go away. So I ended up going to urgent care to see what it could have been, sent me home, thinking oh, it could be a virus, something, bacterial. And they're let's hope it gets better. And it was just not getting better.
And we should acknowledge this was happening at a different hospital, not here at the health system, but you were still feeling sick. Your skin starts to turn yellow, like jaundice?
Yes, and I was told that's pretty normal because of the mono. It's an infection that sometimes sits within the liver. So I was they're oh, that could be a little normal, but if it gets worse, for sure, go get it checked out.
But this has got to be all running through your head, what is going on? I'm too young for this. And I'm sure your mother, Erica, here with us, felt the same. You helped get Adrian to the emergency department. How fast did he go from the ER then into the ICU? And this was escalating quite quickly.
Yes, well, I didn't think anything of it. He's just having throat pain, and I just thought we were going to go to the emergency room and get medicine. Then as we were in the emergency room, he started to decline. His heart rate was going up really high, but his blood pressure was going low. And so as he progressed to get worse, they did they took him back to the emergency room and started prepping him, but things were going really down south.
They were saying that Adrian's organs were starting to fail. They had to intubate him. He was dealing with sepsis. At one point, Adrian, you even said you felt like you were dying.
Yes.
Tell us what that feels like.
So at one point, I just remember being in the ICU and I was on oxygen, and I just felt like I couldn't breathe. I felt honestly, I was drowning underwater, but I was just in a bed, and I was very confused, what was going on. And I just remember everyone slightly in a panic while I was choking, I felt and when they intubated me, obviously they kind of have to sedate you a bit, and for a moment I just could hear everyone around me in a panic, and everything was really dark.
And you could hear people talking about you and your health.
Yes, I heard my mom crying to the nurse, can you please tell me what's going on? I heard my aunt in there as well crying, can you please explain? And it was just a really hard moment because I honestly thought I was dead. I was trying really hard to move, but all I just everything was dark, and I just felt I wasn't breathing. I just felt really still, and it was nice but scary at the same time. Am I dead? And not being able to move as well was just honestly really traumatic.
Well, Gary, and thank you for explaining that, because when people say I felt like I was dying, it's hard for anyone to really understand what that means. And Erica, I understand you had to go get Adrian new clothes. Why is that?
Yes. Well, he was there because he had they had given him so many fluids. When he got there, he was wearing like a size small medium, and he wanted to wear regular clothes. He didn't want the gown, so we went to go buy him some, and he ended up wearing a 2XL. So like he had gotten really swollen.
What's the time frame happening right now? Is this?
This was it within a couple of days that he was there. This was even before he had gotten intubated. He just that day that he had gotten intubated, that's when that happened.
And as a mother, what's going through your mind, if you can remember that time? I know it's emotional for you still.
Yes.
What was happening in the moment?
Like I say, it's just like, how is this? I felt like, am I in a dream? Like, what is going on? Because his health was just, you know, it was just a sore throat when you don't think that you could go from that to
intubation.
Intubation. Yeah, it was very scary.
So Adrian finally stabilized, took some time, but eventually diagnosed a disease called HLH alongside T-cell lymphoma. So Dr. Abiyankar, help us understand what this diagnosis is and what was going on with Adrian.
So as Adrian had described, you know, he was in a life-threatening crisis, in a life-threatening emergency, which is how some patients with HLH can present. And it's a extremely serious condition. And it is rare. And the word HLH is a little bit of a tongue twister, and it stands for hemophagocytic lymphohistiocytosis.
That's why I brought you on the show today, so that you could pronounce that. But go, please proceed.
So it's actually an immune dysregulation that is caused by activated T cells, NK cells, that is triggered by the EBV. So you know, you had the mono, which is caused by EBV virus, and that triggers the immune system, but underlying all that, you had a T-cell lymphoma that was going on. And so this HLH can be sometimes a genetically inherited predisposition in children especially, but in adults and young adults and even older adults, you can see it even up to age 70 sometimes. It's acquired, and it's usually associated with like a immune process. Maybe the T cells have gone bad, which is what happens when you have T-cell lymphoma.
Well, and that's what I'm looking at. Adrian looks so young, healthy.
Yes.
Is there anything that would have, tipped them off that this was going on?
No, really. And as both Adrian and his mom have said, you know, it felt like you had an upper respiratory infection and a bad sore throat, which is what happens when you have mono. You know, you get a really bad sore throat, and 99% of the time, folks get better with that. But rarely it can lead to something like this, where the immune system just takes off.
Wow. So Adrian's brought here to the KU Cancer Center, starts something called SMILE chemo, S-M-I-L-E chemo. How intense is this specific type of chemo?
Yeah, so when he was transferred over here, we did not know that he had the lymphoma underlying. So we just knew that he had HLH that was caused by the EBV virus. The EBV virus, by the way, you had like millions of copies in your blood. So we did further digging after he came here, because we want to know what triggered this immune reaction. And we sent your bone marrow slides out to the NIH. There's a specialist over there, Dr. Jaffe, who looked at the marrow, and our pathologist looked at the marrow, and came to a determination that you actually have a T-cell lymphoma. So it is a EBV associated T-cell lymphoma of childhood or young adults. And so the hallmark of this is high copies of EBV in the system, and then that triggers the abnormal immune response. So there's super high inflammation goes on in the body, which is what causes all the what we call SIR syndrome, like sepsis. When you didn't have any bacterial, they didn't find any typical culprit that's causing the sepsis, resulting in low blood pressure, needing oxygen, and multi-organ failure.
Mom, you were learning a lot.
Yes, I am.
You were learning a lot. I'm listening to Dr. Abiyankar thinking kind of what was going through your mind, trying to understand what was going on, but also just trying to be by your son. And this is where the story gets really interesting, because this treatment that Dr. Abiyankar is talking about puts you into remission, but you still needed a bone marrow transplant. That's where Mom turns from caretaker to donor.
Yes.
How did this come to be?
Well, they had said at the other hospital that he was most likely going to need a transplant, so that's why they had him transferred here to KU, and that we started the process of to get on the list to be a donor. So they put him on the list, and they had wanted to know family members that would be able to maybe be a match. So that's how that came about. I did get swabbed, which was very easy, and then we went from there to see who was going to be the best match for
And
Adrian.
you mentioned the swab, because there's a really a big push to get more people of color on the bone marrow registry. We just want to put this information out there. Here's an image from the National Marrow Donor Program showing the racial disparity out there. Someone with a Hispanic or Latino ethnic background has a 48% chance of finding a match, and the odds are even worse for someone of Black or African American descent. So that is why it's really important to people of color to get out there and do the swab. Go to bethematch.org and you can sign up and save a life. Again, you swab it, you put it in an envelope, you send it back, and boom, poof, you're on the registry and can really step up and save somebody. Adrian stayed in the hospital for more than 100 days post-transplant. Erica, now again, you're also now a patient.
Yes.
You're trying to take care of your son, which is always going to be priority number one.
Yes, yes.
I see the mama in your eyes, but you're also trying to take care of your own health.
Yes.
How were you finding that balance?
It was hard because not only being the caretaker, I was here at the hospital with him the whole time. So sleeping in a recliner, just trying to do all that and be strong for him also, but be physically, mentally, and emotionally exhausted, and all that just kind of.
And let's go to that, because physically, just totally worn out.
Yes.
They gave you extra medication. Is that what?
Well,
extra doses.
When you end up being a match, they give you shots to produce more cells, and so those shots. I'm a big person, so I ended up having to get 4 shots. But those make your bones, you're kind of achy. So maybe for other people it wouldn't be so bad, but
No.
being tired and everything, I was just extra.
You say big, we say beautiful. You are a beautiful person.
Extra achy. So.
And the thing that was really beautiful about it is that you actually connected with other caretakers up in the unit, really kind of tying the whole emotional part together. Tell us about that experience.
Yes. Well, when you are a caretaker of someone who is ill like Adrian, it's hard to watch. That is your loved one, and it's hard to watch them suffer so much. And so as caretakers, we would not want to cry in front of our loved ones. So there was like a group of us and going to the restroom, and sometimes we were each other's support. We'd give each other, they're total strangers. Like some of them, I don't even know their name, but we still would hug each other. Are you okay today? How are you? So it is really hard, that.
How important was that for you?
It was really hard because it was at a time of COVID also, so my family members couldn't be, they would come as they could, but they're limited on how many people you could have to visit. So, and then too, you didn't want to expose, with COVID, you didn't want anybody to bring anything, so it was just hard. But so we were each other's emotional
in it
support.
Together.
Yes, we were.
I always call it you're sitting in the dirt together.
Yeah.
You just got to get in there, and these are the people who really know what you're going through.
Yes.
Nobody on the outside really
is,
knows.
like I said, it's something you don't want to happen, but if you know, you know.
So Adrian, on the day you finally get out, 24 hours later, you're back in. What happened?
So 6 hours after I left the hospital, I just started not to feel well, and I took my temp and I had a fever, and that's a big thing when you have a bone marrow transplant. Once you reach over 100.5, you have to call, and they want you to come back in because you basically have a brand new immune system, not the greatest immune system. So for sure, if you're having a fever, something's going on. So I ended up having a fever like 6 hours after I left and had to come right back.
Okay, and speaking of sticking around here, your recovery continues. Eventually, you end up getting a job here.
Yes.
How did that happen?
Well, obviously, before I got sick, I was very interested in the medical field, and I was looking at other parts of medicine, but I feel like my cancer opened up like a new opportunity and like a new pathway in my career. So I would love to obviously come back and give back to the people who helped me and help other people who went through what I went through. So, hopefully eventually we could get that nursing degree and that RN done and come back as a nurse. But, baby steps. So for sure working
you're sticking around. You're coming back.
Yes.
And I can't imagine how amazing that would be, Dr. Abiyankar, to have a patient going through this really scary time and then having somebody like Adrian who made it through on the other side,
Absolutely.
like holding on to them and saying you got a chance.
I know, this is fantastic, the outcome, mom being the donor and supporting him throughout, and this difficult diagnosis, and you mentioned the SMILE chemotherapy before. It's a combination of intense chemotherapy. We call it SMILE, but it's a pretty intense chemotherapy to go through. And so his immune system was very low even before transplant, and with the transplant we even dropped it further, and that's what, we were very cautious when you started having fevers. We thought maybe the EBV is coming back, and so we were checking for all those viruses at that time, and fortunately it didn't. You did have a fungus infection that complicated the transplant, but you recovered from that, and you didn't have graft versus host disease, so lots of things went smoothly, so that's wonderful.
And you mentioned getting back to school, Adrian. There's a money side to all of this. Researchers are actually calling the financial toxicity of cancer. So you were on college scholarships. So where do you go from here? You're getting get back at it, get back to it.
Yes, just because I do have a new immune system, it's hard for me to kind of stay healthy. When I did go back to college, I didn't necessarily lose my scholarships, but I kind of I don't want to say wasted them, but due to my new immune system and COVID regulations dropping, and I got COVID for the very first time, a couple of times actually, so it was just kind of hard for me to stay in school and keep my grades up if I'm getting hospitalized or having to stay home because I'm fevering or trying to avoid getting sick,
It's just it's like Dr. Abiyankar. It's just like the others, all these sucker punches that come from, you get diagnosed, you're in the hospital, you're sick physically, but then all the things that happen afterwards that affect patients. Erica, you had mentioned that you have survivor's guilt when you were talking about some of these friends that you made up on the unit. What do you mean by survivor's guilt?
Well, I was very blessed to still have Adrian, and even though it was a difficult time, I met all these people, but several of them did not get to take their loved ones home. So when we still have a relationship and they call to see how Adrian's doing, they are grieving, and so it's hard because I don't have words to say, but just to listen with their grief. But I feel bad because you feel like I don't have anything to complain about because I still have my son. But it is still very hard for me as a parent.
Because you still carry the worry.
Because I still carry the worry.
The worry of Adrian.
Yes.
But you have them.
Yes.
And it's again, I appreciate you sharing that part of it because that's something that other loved ones go through, and just kind of what to say, and like you said, just listen.
Just listen.
Listening. Yeah. If you have any questions, be sure to ask them. Use the chat on YouTube or Facebook. We're on the X platform. You can email the Medical News Network. Information is right there on your screen. And before we chat with Dr. Hawkinson, quick shout out. Again, it's Dr. Abiyankar's birthday, celebrating a birthday today. Adrian's very excited. Erica's excited to be here. Your staff. I said, can Dr. Abiyankar come on this date? And they said, well, that's his birthday. And I said, well, what if we show him a little love on his birthday? And they said, oh, please do. We just love working with him. He's just the best. So they thank you for making their environment so great, and we appreciate you being so devoted to our program.
This is a very good birthday gift, and I get this.
It is a gift. Adrian's the gift. I think well said. Well said. Let's check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, still out in Olathe this morning. I guess we'll see you back here next week.
Yeah, I'll be back Monday, and I just want to say happy birthday to Dr. Abiyankar. He looks great for 34.
Right.
Speaking of the topic today, too, him and I have actually taken care of other patients with HLH as well. So just as he said, HLH can be brought on by various infections. We have seen various infections bring that on. So it's always good to work with him and his team. So happy birthday. Yeah.
All right. What's our COVID count as we head into the weekend?
Yeah, the COVID count has been good. So 8 active patients, that's single digits. That's really good. I think we can hopefully get further down into those single digits. Obviously, the goal is 0, but it's unlikely that will happen, but we can be optimistic and hope that it will.
So, Hawk, we've said it before, we're going to say it again. The mRNA vaccine, COVID vaccine, they are safe, they are effective. This time, the proof comes from an independent review board under the National Academies of Science, Engineering, and Medicine. They issued a new report on the possible harms of the vaccine, and the board found only one possible harm, a link between the mRNA vaccine and myocarditis. So, Hawk, what does that link mean? What else did the board look at?
Yeah, I think we do have to continue to endorse and, of course, be transparent about the safety and the efficacy of these vaccines to help reduce and stop that disease burden should you be infected, not only with SARS-CoV-2, but other diseases as well, because we know there's so much vaccine misinformation out there. But being transparent and having these studies is great. So just as you said, the National Academies of Sciences, Engineering, and Medicine, this was a special committee. They were looking at the mRNA vaccines and specifically about 19 different side effects or problems that had been associated with them. And what they did was they rejected really most all of those things. There were a couple that there wasn't sufficient evidence for or against, but they rejected things like female infertility, Guillain-Barré syndrome, which is a nervous condition that can occur sometimes, Bell's palsy, and then thrombosis and thrombocytopenia syndrome, which can occur with that J&J vaccine, but with the mRNA vaccines, they rejected it, and also heart attack. So they rejected all of those things for those mRNA vaccines because we know they have come under the most scrutiny. Now, there was an association with myocarditis, and that is well known, and we have talked about that, mostly affecting younger boys or adolescent boys or young men. But again, the myocarditis really is a mild condition that does resolve quickly. So this is one more data point, especially on an independent evaluating committee, showing that these vaccines are safe. And as of note, they also looked at Novavax vaccine. So if you don't want to take the mRNA vaccine for one reason or another, there is Novavax out there as well. And for that vaccine, there was not enough data one way or the other to suggest there was an influence on any of those side effects. So again, I think that's pretty good news as well. But really, these vaccines are safe.
Hawk, thanks so much. Have a great weekend. We'll see you back here in studio on Monday.
Sounds good.
Let's get to some questions from our viewers. Erica, you mentioned COVID restrictions. How difficult did that make things for you, or was that just another thing you had to deal with?
It was difficult because I have a large family, and when someone's sick, everybody's there. So it was hard because Adrian's very loved also, so everybody wanted to come see him. But it's hard because at that time they was limited, or they really didn't want anybody, if possible, not to be there. So it was really hard to not have that support, because when somebody's going through this, I heard several times that Adrian was very critical, and to have to deal with that alone is hard.
Alone, the support, and then just like you need sleep, people work in shifts to be, to be there for each other and so literally hold each other up. Dr. A, is there a way to catch HLH early? Is there anything that might detect it or pick it up in any other tests you might have?
So there are tests, but there is no conclusive test to make the diagnosis. So it's a rare diagnosis. That's unfortunately quite often it gets missed. So the doctors at the referring hospital did a good job recognizing there's something serious going on, and that it needs to be transferred to our place here so that we can work him up and put our heads together. And
I like that. Yeah, it's good to know that out there in the community they know to send them here, a patient here, when they need that type of care. Jeremy wants to know, does that new immune system after a bone marrow transplant just take a bit of time to so-called fire up to full power, or is an altered immune system just a fact of life afterwards?
So in most patients, the immune system recovers. It takes about up to 1 to 2 years for it to completely recover. And as we've seen in Adrian, he continues to have some respiratory infections. It doesn't help that he works in the hospital, gets exposed to different things. But it takes a couple of years to get back to normal.
Another question, just how is Adrian now? What does the follow-up look like?
So we still see him frequently because he's, as I mentioned, he keeps getting some respiratory infection, upper respiratory. But I think overall he's making great progress, and he's going to be 3 years soon in July from his transplant. That is a very good landmark and he's
Yeah.
doing extremely well.
So he's going to finish nursing school,
Yes.
be a long-time employee of ours. Okay, it's on. It is on. Dr. Abhyankar, again, happy birthday. Thank you for being with us. And what is the big takeaway from this conversation? What do you want people to know?
So it again gets down to team. You know, we have a great team here in transplant and cell therapy, and it's not just us. You know, it's the pathologists who review this, it's all the nursing staff on the unit, all the coordinators, and also having that relationship with the others, community health centers, so that we have good contact and relation with them, and making referrals when it's appropriate to come here. So it all worked in this situation extremely well.
Love to have everyone sitting here with smiles on their faces. Adrian, just what's the big takeaway from your personal story?
Like he said, it takes literally a village, you know, kind of like, you know, how they say it takes a village to raise a child. I consider myself a baby again, you know. Everyone had to re-raise me, the nursing staff, the community, my doctors, of course. But the biggest thing, especially after working here, you know, is like really just trying to stay positive through this and like be able to be dependable on others, you know. Sometimes it's okay to lose your independence to gain your dependence back eventually and get better for yourself.
Oh, you got a good kid right there. You raised a good one, Mom. Okay, so I'm going to let you give us kind of our final thought. What do you want people to take away from this story?
You could save a life. You could save a life. I mean, I'm so blessed to be able to give him life, not once, but twice. And it's just a swab. You could, it's just a couple of hours of your time to give your cells, or, to be able to save someone's life so they can be here and continue to have a life.
And all you have to do is go to bethematch.org.
Yes.
They'll send you a packet, you swab it, you put it in the envelope, you send it back, and you're on the registry.
Yes, yes. And I would like to thank also everybody from the other hospital to here, everybody that once that I stepped foot in my son's room or had anything to do with him. I'm so grateful.
And they are grateful you are here. So thank you for sharing your story. And you'll be back. You'll be back, okay? Come see us. All right. Have a great weekend, everyone. Thanks to all of our guests and our viewers. We'll see you back here on Monday. Coming up Monday on the Morning Medical Update. The first ever test that catches Parkinson's early before symptoms appear, giving patients the chance to start treatment early. I'm Jessica Lovell on the next Morning Medical Update. What needs to happen before the breakthrough becomes standard? Plus, weight loss drugs tested as a Parkinson's treatment. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.